Alzheimer's disease is a disease that engages a variety of disciplines because it's a disease of aging. So it's not even just a disease that occurs in the individual, but also the family and their needs to be taken care of. Because so many people have it, inherently engages society's balancing of resources.
We do not have in place the kind of care systems that this population and their families deserve.
Patients who currently are sick, who currently have cognitive problems, who have dementia, they have a high priority for getting our care, getting our resources. And we shouldn't let the hope of a future treatment get in the way of making sure we're taking care of the presently ill people. So with that stated, what we're paying attention to are how can we structure, or if you will, restructure the healthcare system to better meet the needs of people who have cognitive impairment.
We're going to have to mobilize the public who often don't want to acknowledge this problem, don't want to acknowledge it. They might be experiencing it, but don't want to acknowledge that it's possible for them. We have to get them to understand that this is the challenge of this century. It's the challenge for their children and their grandchildren, and it's going to eat up human and economic resources if unaddressed.
We are now in the age of where the baby boomers are coming into high risk for developing Alzheimer's disease and other dementias.
This is really a hugely serious problem that's not going to go away on its own. A disease whose costs are currently 1% of GDP, $604 billion, that will triple, quadruple in the next 50 years.
That a difficult concept that we have to get across and educate the public is one of what it means to be at risk. So the biomarkers identify a biological process that's going on in the body, but that doesn't 100% mean that it's going to translate into some change in your health and the way you deal with life. They could mean that in 2 years they're going to have significant memory problems. It could be in 10 years, 15 years, or never that they develop it. Even if someone has a biomarker profile suggesting that they have Alzheimer's disease in their brain, there's still so much variability.
The drugs we have now that are prescribed for patients are symptomatic drugs. So that's the equivalent of taking aspirin for a pneumonia rather than an antibiotic to cure the pneumonia. Right now, we have drugs in clinical trial. There's perhaps $1 billion or $2 billion invested by pharma in disease-modifying therapy. The clinical trials that are in process hopefully will culminate in the success of a drug that actually modifies the disease. By that I mean shutting down the disease, arresting its progression, so that people will not develop more severe dementia and eventually have to be in a nursing home or have full-time caretakers.
We think about people as having diseases, such as Alzheimer's disease, but it is absolutely rare that a person has just one of anything. That our work over the last several years has focused on this population living longer who are accumulating problems, accumulating numbers of chronic conditions. So Alzheimer's disease for this population becomes one more that contributes and substantially complicates their lives. The challenge is who's watching over them throughout the entire experience. How is it that we can begin to position this population so they don't have to enter the emergency room or hospital? Or if they do, how can we help them transition back to their community, to their primary care providers, so that everybody knows what happened and what's the new plan of care and how can we implement it to prevent future interruptions in this chronic illness trajectory. The goal of transitional care is to interrupt the real downward trajectory that is the characteristic of people living with Alzheimer's and multiple other chronic conditions.
Collaborative events like this WARE conference are essential to make progress in Alzheimer's disease, because Alzheimer's disease is in a special category of diseases. It's not just one discipline's problem, like say, pneumonia, which largely occupies the world of infectious disease, or tuberculosis. Instead, Alzheimer's disease is a disease that engages a variety of disciplines because it's a disease of aging.
We've had investments in our society and again across the globe in discovery of new treatments in the area of cure. But we have to confront the reality that we don't have a cure around the corner. We have people with the disease today. We have people who are positioned to develop this disease in short order as our population ages.
We may be victorious next week or a year from now, but if we're not, 10 years from now, we still have to stay the course. This, again, is the disease of our generation.
There is a tremendous urgency to intervene and to do what we can to prevent it.
We need not just more incremental stuff related to Alzheimer's disease. We need to create a new equation, a new paradigm, a procedure for dealing with this disease, the sixth leading cause of death, the only disease in the top 10 causes of death for which there are no therapies.